Hello, everyone. I'm State Senator Annette Cleveland, and so pleased to be joining you again this year, and just so sorry that I'm not able to join you in person, but want to take a moment to share a little bit about what priorities are in front of us for the 2026 legislative session when it comes to healthcare, and also ask for your continued support and help and partnership as we face some really challenging and difficult times ahead. First and foremost, as you are well aware, as a state, I think it's safe to say that it's our top priority to work to implement H.R. 1, the bill that Congress passed in July. That bill has the unfortunate consequence, most certainly, of causing many across our country, many in our state, to lose their health care coverage, whether it be Medicaid or health care coverage that they currently are able to afford due to the federal subsidies. And of course, at this time, we don't know if those federal subsidies are going to be reauthorized going forward by Congress this year or not. If they are not reauthorized by the end of the year, they will end. That will be the most immediate effect that we experience in our state of those who will have difficulty being able to afford healthcare coverage going forward. So for us, it is of top priority that we do all that we can to help mitigate the impacts of H.R. 1 as it's being implemented and work to preserve and maintain for as many individuals as possible in this state the healthcare coverage that they so rely on. When I first came to the legislature, our uninsured rate in the state was approximately 17%. In the time that I've been here, that uninsured rate has fallen to under 5%. And I think that that's work that all of us can feel proud of, but also need to join together to work to protect as this new federal legislation is implemented by our state and by others. Want to mention too, though, that as a priority, I'm also very focused on continuing our work as a state to implement healthcare reform, healthcare transformation, and continuing to focus on those pillars that get us there. Access to coverage, access to affordable care, access to quality care. And so those are going to continue to stay in front of us as priorities as well. We also continue to face dire workforce shortages within the healthcare sector. That is another priority that we're going to continue to stay focused on. And additionally, I believe that we can continue to work to expand our telehealth capabilities, particularly around access to behavioral health services, because we want to ensure that, again, we're not veering away from all of the hard work that we've put in together to ensure that there are access to really important services that those in our state need. I will mention that, as I know you're all aware, the first impacts of implementation of H.R. 1 are going to be felt pretty immediately, dependent upon whether the federal subsidies are extended or not, but also know that Medicaid cuts, the Medicaid work rules, and cost sharing increases all begin initially this year and are going to intensify through 2027. We also know that gender-affirming care, that ban will be enforced starting January 1st of 2027. So we have to keep that in mind. And we also are watching closely some of the challenges and lawsuits that are being filed that might reshape or delay some of the implementation of H.R. 1 as well. I believe that we as a state have already identified some proactive steps that we can take to help mitigate coverage losses. But I think that we also have to work together to focus on creating, to the extent that's possible, some stability, some certainty for patients in our state, and working hard together to maintain a sustainable healthcare system that's viable so that services can continue to be available. The other thing that I'm hanging on to that I want to share with you today is the fact that working in healthcare requires that we all continue to embrace hope. It's very much a part of healthcare, and so hope that you'll join me in maintaining that positive outlook as well as we all move forward through these really difficult times. So what I would most ask of you right now would be for your help in sharing and supporting ideas for us as a state to help us mitigate coverage losses and help us maintain the coverage gains that we as a state have been able to realize through all of our hard work over the last decade. And also ask that you help us continue to make progress forward in our healthcare transformation work. We do not want to take our eye off that really important goal. Finally, I know that you're well aware that our state's Universal Healthcare Commission, that's been hard at work laying the building blocks, the foundation for universal healthcare coverage in our state, continues to also work hard. And our next steps are being considered in terms of what makes sense to focus on for the next transitional step forward. And so I ask that you also join in sharing with me, with others of us on the Universal Healthcare Coverage Commission, as well as other members of the legislature, what it is that you feel will be most impactful in terms of next steps forward. So look forward to that continued conversation with you. Want to recognize and thank you for all of your hard work, and particularly your partnership in the past number of years where we've made great strides toward universal health care coverage, but also really asking for your patience and your support and your help as we walk through this next legislative session in 2026. So thank you for inviting me to share a little bit about what we're looking at for next year, and hope that I will see you in January in Olympia. Thank you so much.